Throw this vitamin from your medicine box away now. Do you know certain vitamins you're taking right now might actually be making you weaker, not stronger, especially if you're over 60? Comment stop if you've ever taken supplements without checking with your doctor. Number 1. Vitamin E, the bleeding risk that grows with age. You may not feel it now, but after 60, your body's ability to stop bleeding starts to change, and if you're taking high-dose vitamin E, that change could become dangerous. Now here's the twist. Vitamin E sounds helpful. It's often marketed for heart health and aging skin. But when taken in high doses, usually above 400 IU a day, it can thin your blood too much, especially if you're already taking medications like aspirin, warfarin, or clopidogrel for chronic conditions. Here's what happens with aging. The walls of your blood vessels become more fragile, your liver processes drugs more slowly, and you may bruise or bleed more easily, sometimes without realizing why. Vitamin E interferes with vitamin K, which your body needs to form clots and stop bleeding. That may not seem serious until one day you notice dark bruises that don't go away, bleeding gums, or you feel dizzy just standing up. According to the American Heart Association, there is no benefit to taking high-dose vitamin E for heart protection. In fact, studies suggest it may increase the risk of hemorrhagic stroke, a type of bleeding inside the brain that's more likely in older adults with high blood pressure or weak vessels. For safe and effective senior health tips, it's better to get small amounts of vitamin E from food like almonds, sunflower seeds, or spinach, and avoid unnecessary supplements unless prescribed. In the aging body, more is not better. It's riskier. If the idea of vitamin E causing harm made you pause, what comes next might feel even more unexpected, especially for anyone with a long history of smoking or breathing issues. Number 2. Beta-Carotene supplement, the antioxidant that backfires after 60. This one might raise your risk of lung cancer, and it's still sitting in your cabinet. Beta-carotene is often seen as a harmless nutrient. It's the natural pigment that gives carrots, sweet potatoes, and pumpkin their orange color. And yes, in food, it plays a healthy role in supporting your eyes and immune system. But here's the part most people don't know. Once it's pulled out of real food and turned into a high-dose supplement, beta-carotene may do more harm than good, especially as you get older. Several large-scale studies, including one from the National Cancer Institute, found that beta-carotene supplements increased lung cancer risk in older adults who smoked or had long-term exposure to air pollution or asbestos. This risk wasn't subtle, it went up by as much as 18%. Why does this matter for senior health tips? Because many people over 60 have a long history of smoking or live with compromised lung health, chronic bronchitis, asthma, or shortness of breath that comes and goes. As your lungs age, they become more sensitive to cellular damage. And high-dose beta-carotene can actually interact negatively with that damage, fueling abnormal cell changes instead of preventing them. If you've ever dealt with a chronic cough, chest tightness, or even mild fatigue during activity, your lungs may already be under stress, and that stress doesn't need more confusion from the wrong supplement. Instead of popping pills, stick with the natural form. Load up on colorful vegetables, carrots, spinach, red bell peppers. Your body knows how to process those without tipping the scale toward risk. For safer senior health tips, always choose food over synthetic capsules, especially when it comes to antioxidants. Some things only work right in their original form. Does this one surprise you? Drop a 2 in the comments if you've ever taken a beta-carotene supplement without thinking twice. Number 3. Vitamin C, high doses over 2,000 milligrams. Why too much can hurt your aging body. If you're over 60 and still taking high-dose vitamin C every day, your kidneys may be struggling more than you think. As we age, our kidneys gradually lose their efficiency. It's a natural part of the aging process. But here's the problem. Vitamin C is water-soluble, meaning your kidneys are responsible for flushing out whatever your body doesn't need. And when you take too much, they're forced to work harder to filter it out. That strain adds up over time. High doses, especially those above 2,000 milligrams per day, don't make you healthier. Instead, they can lead to kidney stone formation, especially in older adults who may already be mildly dehydrated or taking diuretics for high blood pressure. And that's not all. The aging digestive system produces less stomach acid and moves more slowly, which already makes gas, bloating, and irregular bowel movements more common. Adding excess vitamin C can worsen these symptoms, causing frequent diarrhea, abdominal discomfort, or even lightheadedness from fluid loss. You might have been told for years that vitamin C is safe no matter what, but as your body ages, the same habits don't work the same way. According to the Mayo Clinic, there is no proven benefit to megadoses of vitamin C in preventing colds or infections in healthy adults, and the risks grow higher with age. For realistic senior health tips, skip the fizzy megadoses. Choose whole foods like oranges, strawberries, and bell peppers. Just 75 to 90 milligrams a day is enough. And it's easier for your body to handle in natural form. Remember, after 60, aging well isn't just about getting nutrients. It's about not overwhelming the systems that are already working harder to keep you balanced. So, if you've made it this far, here's what we've really uncovered. First, that vitamin E might not be the heart helper you thought, especially when your blood vessels are more fragile with age. Then we looked at beta-carotene and how something that sounds healthy can quietly turn on you, particularly if your lungs have been through years of stress. And finally, even vitamin C, yes, the classic, can push your kidneys too far when taken in heavy doses. The truth is, after 60, your body's just different. And that means your vitamins should be too. If you found this helpful, don't forget to subscribe to Healthcase for more senior health tips you can trust, straightforward, science-backed, and made just for you. But the good news is, aging well isn't just about avoiding the wrong things, it's also about adding the right ones. So let's talk about the vitamins that actually support your body after 60, gently, safely, and exactly where you need them most. Number 4. Vitamin D, the quiet strength your body still needs after 60. If it feels harder to get out of a chair lately, low vitamin D could be part of the reason. As you get older, your body naturally starts losing muscle mass. But here's what many people don't realize. Vitamin D plays a critical role in muscle strength, balance, and bone density. And after 60, your ability to make and use vitamin D drops significantly. Why? Your skin doesn't produce as much from sunlight. You may spend less time outside. And even when you do, your kidneys, already aging, become less efficient at converting it into the active form your body can use. Without enough vitamin D, your muscles weaken faster. That's why small things like walking upstairs or rising from the couch start to feel like a chore. You might notice your knees aching more, or that you feel unsteady for a few seconds after standing. These aren't just signs of getting old, they could be warning signs of a vitamin D deficiency. According to the National Institutes of Health, adults over 70 should get at least 800 IU of vitamin D per day to maintain strong bones and muscles. Yet studies show that more than 25% of seniors in the US aren't getting enough. For practical senior health tips, aim to get 15 to 20 minutes of sunlight in the morning when possible. Include fatty fish like salmon, fortified milk or eggs in your meals, and if your doctor recommends a supplement, choose vitamin D3, it's better absorbed. Because once you pass 60, Staying strong and stable isn't just about working out or eating more protein. It starts with the right foundation, and vitamin D is a big part of that. Vitamin D takes care of your strength and balance, but what comes next is just as important, because clear thinking and steady energy matter just as much. Number 5. Vitamin B12, the brain fuel that slows down after 60. Ever walk into a room and forget why you came in? You're not alone, and sometimes it's not just aging. As you get older, your body becomes less efficient at absorbing vitamin B12, even if you eat plenty of meat, eggs, or dairy. That's because your stomach starts producing less acid, a normal part of aging, which is needed to unlock B12 from food. And without enough of it, your nerves and brain start to feel the effects. You might notice more mental fog, trouble focusing, or even small mood shifts. Some people feel unusually tired, even after a full night's rest. Others describe a weird tingling in their feet or hands, or a general sense that something just feels off. But here's the science behind it. Vitamin B12 is essential for maintaining nerve function and forming healthy red blood cells. When levels drop, those systems don't perform as well. Over time, low B12 can even mimic signs of dementia, confusion, memory loss, or poor coordination. According to the National Institute on Aging, up to 30% of adults over 60 have trouble absorbing vitamin B12 from food. That's why many doctors recommend seniors get their B12 from fortified cereals, sublingual tablets which dissolve under the tongue, or low-dose injections depending on your needs. For realistic senior health tips, consider getting your B12 checked during your next physical, especially if you've been feeling more tired or forgetful than usual. A simple blood test can make all the difference. Because keeping your mind sharp and your energy steady isn't just about doing puzzles or drinking coffee. Sometimes it starts with giving your brain the fuel it's quietly missing. If you've been feeling more foggy or tired lately and didn't know why, type B12 check. It might be time for a closer look. Number 6. Vitamin C, the gentle shield that supports you daily. Noticing it takes longer to shake off a cold these days? Or that small cuts just don't heal as fast? That's your immune system slowing down, a natural part of aging. But here's something simple that helps. A small, steady dose of vitamin C from real food. Vitamin C isn't about megadoses or fizzy tablets. In fact, those can be hard on your digestive system and unnecessary after 60. What your body needs is consistency, a light daily supply that quietly supports your cells, heals your tissues, and keeps your immune defenses ready. And here's what makes vitamin C special. It helps your body produce collagen, which keeps your skin strong, supports wound healing, and protects fragile blood vessels that weaken with age. It also boosts your absorption of iron, something many older adults start to struggle with. And the best part? You don't need pills to get it. One orange, a handful of strawberries, a small bowl of cooked broccoli, even a few slices of bell pepper in your salad. That's enough. According to the National Institutes of Health, just 75 to 90 mg of vitamin C per day is all you need for strong, balanced support. For realistic senior health tips, forget the megadoses. Trust your plate, because when it comes to aging well, the quiet nutrients, taken the right way, are often the most powerful. While vitamin C works quietly to protect your immune system, the next part brings it all together. How these small habits build real momentum as you age. Number 7. Build strength, clarity, and immunity, one step at a time. What would it feel like to wake up with more energy, better balance, and a clearer mind? Because here's the truth. After 60, your body doesn't need more things, it just needs the right ones. small shifts that match how your body actually works now, not how it used to. And when you give it what it truly needs, like steady vitamin D to support your legs and bones, or a gentle supply of B12 to keep your mind sharp, it starts to respond. Slowly but surely. You might notice it takes less effort to get out of a chair, that you're more alert during conversations, that you bounce back from a cold a little faster than before. That's the kind of progress that matters. See, aging isn't about decline, it's about adapting wisely, choosing nutrients that respect what your body's going through, listening when it whispers, not waiting until it shouts. And that's what these small habits are: quiet acts of prevention, anchors of stability when everything else feels like it's speeding up. For practical senior health tips that actually work, focus on 3 things: stay grounded, stay sharp, and stay steady. The rest will follow. And no, you're not too late. You're right on time. Which of these habits feels most doable for you right now? Drop the number. 4 for strength, 5 for clarity, or 6 for immunity. Let's see where you're starting from. So what does that look like really? It looks like getting a little morning sun on your skin, not just for warmth, but for balance. It means giving your brain the fuel it's been missing, so you can feel present, not just awake. And it's letting simple, everyday foods do the quiet work of keeping your immune system steady. None of it has to be extreme, just steady, thoughtful, aligned with where your body is now. And the best part? You don't need to do it all at once. One shift at a time is more than enough. And once you've chosen the right vitamins, there's still one more thing that often gets overlooked, but makes all the difference. It's not just what you take, it's how and when you take it. After 60, your digestion works a little differently. Some nutrients just don't get absorbed the way they used to, especially if they're taken at the wrong time or on an empty stomach. For example, vitamins like D, E, and K, they're fat-soluble, which means your body absorbs them better when they're taken with a meal that includes healthy fats, like eggs, nuts, or even a little olive oil. Others, like B12, might give you a little energy boost, so they're better in the morning, not right before bed. And if you've ever taken vitamin C on an empty stomach and felt a little queasy, you're not alone. That's your body saying, "Give me something to work with." Here's a simple tip we share in our senior health tips. Take your vitamins with your meals, not between them. Make it part of your breakfast or lunch routine. Set a phone reminder if you need to. And don't be afraid to spread them out during the day if your stomach feels better that way. Because sometimes, the secret to making your supplements work isn't more pills, it's just better timing. That's just one part of making your vitamins work for you. There's something else just as important: knowing what's actually inside the bottle. Vitamin labels can be confusing, even overwhelming, but after 60, when your body becomes more selective about what it can absorb, those tiny details on the back of the bottle start to matter a lot more. Take B12, for example. You'll sometimes see it listed as cyanocobalamin, a synthetic form that many older adults struggle to process. What your body often does better with is methylcobalamin, a form that's already active and easier to absorb. The same goes for vitamin D. The version labeled D3, cholecalciferol, is much more effective than D2 for most seniors. Then there's vitamin E. If the label says dalma-tocopherol, that's a synthetic form. Look instead for dalma-tocopherol, or better yet, mixed tocopherols, which are closer to what you'd get from food. One of the best senior health tips when shopping: look for third-party certifications like USP or NSF. That means the supplement's been tested for purity and quality, not just clever packaging. And if something on the label doesn't make sense, ask your pharmacist. It's their job to help. You don't need to become an expert. Just knowing what to scan for and what to skip can go a long way toward making sure what you're taking is actually helping you age well. Even when you're taking the right vitamins in the right form at the right time, there's still one hidden factor that can quietly get in the way: your medications. It's something most people don't think about, but as we age, many of us start taking daily prescriptions for blood pressure, cholesterol, heart rhythm, or digestion. What doctors don't always tell you is that some of those very medications can block your body from absorbing essential vitamins. Take acid-reducing drugs, for example, like proton pump inhibitors or antacids. They help with reflux, but they also lower stomach acid to the point where it becomes harder to absorb vitamin B12, magnesium, or iron. Then there are statins, the cholesterol-lowering drugs taken by millions of seniors. What many don't realize is that they can also deplete CoQ10, a nutrient that supports your muscles and energy. Even common diabetes medications like metformin have been shown to lower vitamin B12 levels over time, and once that happens, you might start feeling more tired, more forgetful, or more sluggish without knowing why. One of the best senior health tips isn't just to take the right supplements, it's to tell your doctor exactly what you're taking, both medications and vitamins, and ask if there's anything you might be missing. You might just uncover a small fix that makes a big difference in how you feel. All those tips we just walked through, they're not just small adjustments, they're early steps that can protect your balance, your focus, and your overall strength in the years ahead. The sooner you start, the sooner your body starts responding. Even simple changes like timing your vitamins right, choosing better forms, or checking what your medications are blocking, they all add up. At the heart of this video is one simple message. Aging well isn't about doing more, it's about doing what works for you. And the right vitamins, in the right way, can quietly change the way you move, think, and feel every single day. If you haven't had a full checkup in a while, this is your reminder to schedule it. Drink your water, take care of your energy, and if this helped you in any way, follow healthcase for more clear, science-backed senior health tips. You can also share this video with a friend who might need it. The right information at the right time. That's how we stay strong together.